Because I was such a high-risk patient, um, getting the surgery was pretty scary. I went in very fearful. Um, my doctors were even concerned so much that they delayed my surgery by 4 hours to make sure they had a crash cart there because I was in really bad shape. When I first investigated getting actually the bypass surgery, gastric bypass surgery, I was told that I probably had maybe a year to live because I was so sick. And I had diabetes, I had sleep apnea, I had congestive heart failure, and numerous other things, you know, just the list went on and on. And so, you know, initially they decided that I couldn't lose weight because I was taking 120 units of insulin per day, which is a whole lot of insulin. What a lot of people don't understand is that insulin creates fat cells. And some doctors, if you talk to them, they go, oh, you're just eating too much. And I tell them, no, I'm having to take too much insulin because I'm insulin resistant. And all this insulin I'm taking is making me fatter. Well, finally, I got a diabetes doctor who understood all that. And he says, no, we have to get you off insulin. But they tried everything possible to get my sugar under control so I wouldn't have to take insulin, to no avail. And they said, well, we have to get you to lose weight. Well, how are you going to do that when you're having to take so much insulin? And I didn't really eat that much. I didn't have that big of an appetite. So initially my diabetes doctor wanted me to get the gastric bypass surgery. And so I went through a whole year of all the testing and all the stuff they make you do before they'll do surgery. And they make you lose a little bit of weight on, you know, before they, which doesn't make any sense to me, but they do make you lose like 20-30 pounds before you start. And I was scheduled to do surgery, and the day before my surgery they called and they had to cancel because the surgeon couldn't be there. So that meant that they were going to push it off another couple of months. Well, we got down to a week before the surgery and they called me and said, oh, we can't do it, you're too risky. You have your kidneys are dumping too much protein into your urine, and you'll probably have renal failure in surgery. We can't do the surgery. And I'm going, well, that's good. I said, because without it, my doctor tells me I'm going to die, and then you're telling me I'm going to die in surgery. So what difference does it make? Do the surgery and let's take a chance, you know. And so I kept fighting with them for about 3 or 4 days, trying to get them to approve the gastric bypass, because I thought that time I thought that was the best thing because that's what my doctor told me. Well, the surgeon who did my surgery said, well, the only thing that I will do for you is I'll do the lap band. He says that's less invasive and I feel safer with that than I do with the other. I'm not feeling good about anything, but I'll feel safer with that. Well, my diabetes doctor wouldn't approve the lap band. He wanted the bypass. And so, I don't know, a team of doctors got together and argued for a week, and I kept calling and trying to get it together. And they finally got my diabetes doctor to say, okay, we'll do the lap band, much against his will, but we'll do that. And that's what they did. Now today I'm really glad that we did that. But it was touch and go as to whether I was going to get any surgery at all. And at the time I felt miserable. I couldn't walk 20 feet without being out of breath. I had a 2-story house. I couldn't even get up to my bedroom without feeling like I was going to pass out and feeling like I was having a heart attack. And I'm a singer. I could hardly get through a song singing. I play harmonica, forget that. I barely had enough breath to do that. And just everything in my life was on hold because I just couldn't function. I became diabetic when I was 34 years old. And it was kind of a hereditary thing. My father and everybody else in the family is diabetic, so it wasn't a surprise that I was, but it was mostly brought on because I was already overweight. Not as large as I got, but I had put on a lot of weight, and it was just it started out, trying to control it with diet. And I struggled with that for about, I don't know, maybe 3 or 4 years. And I just wasn't getting anywhere. And my sugars kept getting worse and worse. So they finally decided to put me on insulin. And that's when I really started having a lot of issues, when I started taking insulin. And we started out with a small amount, but because I'm insulin resistant, and of course the heavier you get, the more insulin resistant you'll become, I kept having to take more and more and more. I mean, prior to that I was taking massive doses of oral medications to the point where I had maxed out any kind of medication that there was, and it just wasn't doing any good. The diabetes led to other complications. I'm legally blind. My vision at the moment is 2400. I'm undergoing a lot of surgery to try to fix that, but I've already been through a ton of surgery. But that was probably the first setback from diabetes. And I have neuropathy quite severely, so that I'm in pain most of the time. My hands and my feet and whatnot are hurting all the time. Of course, then the other things that go along with that, the congestive heart failure, the kidney damage that I've had from diabetes, and then of course the sleep apnea from being overweight, and it's just been a real struggle, a real uphill struggle for over 20 years. I've had a lot of friends that have probably as many ailments as I've had, including diabetes, heart problems, strokes and stuff, and more than I have. And they've been concerned, and I've reassured them all that, with all the problems I've had up until I got my surgery, that I probably would not be alive today if it hadn't been for the surgery. The surgery, it was like almost instantaneous that I felt relief from all the things that were bothering me. The scariest things for me was the edema that I was experiencing, because my legs, my hands, everything was so swelled up with fluids. My legs were so swollen that they were like overinflated balloons. I mean, like how you can take little balloons, and you can twist them and make animals and stuff out of them. Well, my legs were so swollen you couldn't bend them at all. I couldn't bend my knees to get upstairs or anything. It was incredible. My feet were so swollen I could not wear shoes. And almost overnight, all of that was gone. It was incredible. I felt like all of a sudden I could walk again. I could breathe again. The other things, little by little, started going away, but it was like, it was miraculous to me. Within the first month, I felt like a totally new person. It was so much of the health issues I had were gone. And, it had to be the lap band. From my experience and the other people I've met that have had the lap band, the more at risk you are, the lap band is really much more the answer.